My name is Doug Kanis. I'm an internist at Pella Regional Health Center. I also work there as a CMIO. I think it's pretty easy to see how in the clinic you want to be able to move around from exam room to different spaces, and that makes sense, and being mobile and having that mobile solution is fantastic. It really improves your efficiency. In my position, moving from a clinic environment and oftentimes running over to the hospital, you really need to have that mobile solution with you, and it really saves you a lot of time. I've also experienced leaving my facility and going out to the nursing home or going out even into patient homes where I still have an internet connection. I can use my mobile device to access the information I need and really get everything I need at the point of care wherever I'm at, if I'm in my facility or anywhere else in the community where I happen to be. You can bring the mobile solution right to your patient in the examination room and show them the results of their studies and have a really good conversation about it. And so I think it really improves patient care because it improves patient understanding of their condition. MEDITECH's portal has been remarkably beneficial to assist with communication between patients and the care team. You want to use the portal and you want to engage with your patients, and then they do a very good job of it. They are on the portal, they're reviewing their results, they're sending messages, they're scheduling appointments, and it's a great thing to have with your patients. My patients really enjoy it. A ton of my patients go down south for the winter, and so they're not able to communicate with my clinic so well through the phone system and such, so they found it to be a really good way to communicate with us. It's really changed the way we've practiced in Pella because people are really engaged with our patient portal. Yeah, adoption is, I think, difficult just in general as you think about trying to get providers to want to adopt new software because they've had bad problems with software in the past. They've been utilizing EHRs that are not efficient, and to get them to use something different is tough. But with Expanse, I think that it's fundamentally different from what people have seen before with an electronic health record. You're seeing a solution that really is intuitive. You see a solution that is really designed by physicians. And so if you can show the providers how it was designed, what the thought process was, and how much personalization and optimization they can do individually for their workflow, it really is something they want to adopt and utilize. So once you kind of get over that hump and show them the solution, even though they might kind of be biased initially, they really do buy in well, and we've really seen good adoptions. One of the things I've noticed is that when I walk the halls at 5 o'clock, my colleagues aren't there anymore. That means that they're closing their charts by the end of the day and they're getting home, so I know that they're much more efficient. The intuitiveness is fantastic. I've seen MEDITECH take this solution and go through multiple different user groups to really maximize the intuitiveness of this product. And then when you sit down with physicians one-on-one on an individual basis and show how they can specifically and individually customize and optimize a solution for their specific workflow, it really improves the utilization and efficiency remarkably. It's so impressive. I enjoy it so much in my day-to-day practice, but to be able to share that with people and see how they change it for them as well, you get a different perspective when you sit with an internist than you would a pediatrician or a surgeon. They all want different components optimized and customized for them, and to be able to do it is fantastic. There are metrics that we have been analyzing since we've implemented the MEDITECH solution, and those metrics have to do with improvements in patient care, such as have our patients' hemoglobin A1Cs improved, have their blood pressures improved, the things that we do for ACO and for MIPS, and we've been monitoring those with the assistance of MEDITECH and the registries, and we're really showing improvements in those metrics and in closing the care gaps for our patients too. I mean, I get to experience that benefit from many different scenarios. So one scenario is in the clinic. Obviously, I can have patients that are going to be seen in one of our Pella Regional outlying clinics that's in a town 40 miles away. Maybe they're in the emergency department and we're seeing there, maybe they're in wound care, and they're having all these different visits, but I'm able to pull all that information together into one place. And I'd love to have that at the point of care when I'm in my clinic or wherever I meet the patient to be able to care best for them. So wherever I meet my patient is appropriate to have that information pushed to me, but I'm confident with the integration of the MEDITECH solution. Wherever my patient presents, if they come into the ER, I know the ER doctor is going to have the right medication list, they're going to have the right allergy list, they're going to have my note available, they're going to have all the lab tests that they've had done available to them. All that information is getting pushed to the point of care from wherever it's done through the facility. So that integration is key. I think there's several different things that MEDITECH's EHR does for patient safety. There's a lot of clinical decision support that's supported by the system. So a lot of that comes from MEDITECH, and we can kind of pick and choose where do we want that support in the system. But we also have the ability to build our own within the system too. So when we specifically identify that we're going to pursue an antibiotic stewardship program, we can build in the CDS that we want to have in the system then as well. But MEDITECH is also pushing different toolkits out to us, like the opioid toolkit that does a fantastic job. Toolkits and monitoring parameters for like sepsis and CAUTI have been really good as well.